you're diabetic, there are lots of complications beyond the fact that you've got different blood sugars to everybody else.
People with diabetes can suffer from what's called peripheral artery disease, which means that the blood flow and the blood vessels to the legs and feet are narrowed, which means that there's reduced blood flow.
That can often result in what is known as a diabetic foot ulcer, and those ulcers can deteriorate, become infected, and if they're not managed and treated appropriately, the wound can deteriorate to such an extent that it inevitably results in an amputation.
People with diabetes are 15 times more likely to suffer an amputation than somebody without diabetes, and more than 80% of amputations begin with a foot ulcer.
In my experience, although amputations following the development of a diabetic foot ulcer aren't common, it is something that both the patient and all of their treating clinicians need to bear in mind may be that last resort if the intervention isn't quick enough and the management isn't correct.
Patients suffering from diabetic foot ulcers need to have their condition managed very carefully, and they need to have wounds dressed and regularly changed. The wounds also need to be managed and observed frequently to ensure that they're not getting any worse. So it's really helpful if there can be consistency in care in nurses reviewing the wound to check that it's not getting any worse.
There are often a number of people involved in a patient's care that could and should identify a foot ulcer, whether that be a community or district nurse, a GP attending upon a client at home, or indeed in a general practice setting, or whilst a patient's in hospital.
These cases can potentially be of quite high value due to the issues of mobility or potentially somebody losing their job as a result of the negligent treatment.
An amputation can be one of the most devastating things that can happen to an individual.
It's going to lead to a lifelong reliance on walking and mobility aids. There might be some prosthetics that needs to be put in place. People often have to move home because the home that they're in needs too many adaptations to that house so that they can live and move around it comfortably.
If a patient has had to have an amputation that could have been avoided, then the costs associated with making those adaptations and or moving home can be recovered as part of the claim.
If someone feels that the care they haven't received in respect of a diabetic foot ulcer has fallen below an appropriate standard, then we're more than happy to discuss a potential claim with them.
A claim for compensation following a negligent amputation can hope to put somebody back somewhere near the position they would have been in if they'd got the treatment they needed and been able to avoid that amputation. That's the ultimate aim of the medical negligence case.